Hello, everyone, and welcome back to Freely Nourish, the podcast that empowers you to break the cycle of dieting by teaching you to nourish your bodies well. My name is Erin Casey. I am your host and registered dietitian. I am also the owner of New You Nutrition Counseling, where we believe that you can be healthy and reach your health goals at any body size, and you can do that by including all of your favorite foods. So if you are ready to let go of the toxic cycle of dieting, and indulge in a journey of food freedom and true health, then we are here for you. This week, I come to you with a pretty special episode. These are questions that I get from my clients very often. And of course, it is something that is heavily talked about in nutrition media as well, and that is the issue of things such as digestive problems, as well as food intolerances and allergies. So let's dive in without further ado. So, as some of you may know, one of the healthcare facilities where I used to work, I was actually their resident GI expert. GI issues or gastrointestinal issues. I guess I should back up and start there. Gastrointestinal issues. So those are things affecting your gastrointestinal tract, such as your esophagus, your stomach, your small intestine, your large intestine. And also all of your ancillary organs, such as your liver and your pancreas and things like that. So I studied a lot about kind of how those different systems are impacted by nutrition, how diseases of those systems are, affect your ability to digest and break down different nutrients. So I'm definitely an expert in this field, and it is a very common thing that a lot of my patients come to me with. So I want to kind of start out by kind of going through some basics of kind of what different diseases are and are not. And then I'll kind of branch off onto the ones that are kind of more heavily affected by nutrition. I'll say it that way. So kind of there are some that, while I certainly understand the disease state very well, there's not a whole lot we can do nutritionally to manage it. So I don't want to spend a whole lot of time today talking about that. We'll instead kind of focus on the things that are relevant to my scope of practice, which is nutrition. Um, so, the problem when we think about GI diseases is that very often the symptoms are pretty universal, and it can be really, really tough to understand kind of, well, what exactly is going on because the symptoms are all the same. Right. So I think it's definitely something that a lot of people struggle with, and kind of trying to figure out what's going on can be really tough just because, again, the symptoms are all the same. So there are kind of two, maybe three main categories of kind of digestive issues that we tend to think about. There's inflammatory bowel diseases. So those are things like Crohn's and colitis, things where, there's kind of a very heavy immune component. There we go. That's the word I'm looking for to it. And honestly, those really involve kind of a lot of kind of higher diagnostics. And really kind of more heavily rely on medication to manage. There's also things like diverticulosis and diverticulitis, which really is more of those are kind of when we have like small pockets form in the colon, and then because there's pockets there, unfortunately, that also kind of makes itself prone to an abscess growing. So kind of the way we recommend kind of getting away from that is plenty of adequate fiber and water in the diet. But other than that, again, kind of once those things flare, unfortunately, we kind of are reliant on medication. And then we get into kind of everything else that can be wrong with your digestive system. And I want to be explicitly clear that I am like probably barely grazing the surface with today's podcast. There is much, much more to your digestive tract than what I'm going to talk about today. But these are kind of like the common things that I hear the most about and get the most questions about. So if you hear some of this is kind of like, well, I'm curious about digestive disorders, but she didn't talk about the thing that I'm the most curious about, leave me a comment, leave me a question. I'm more than happy to either answer it, or of course it may be, if I get enough questions about the same topic, I'll gladly make a TikTok, a YouTube about that specific topic as well. So, kind of to that end, I hear a lot of things about kind of food allergies, food intolerances, and IBS. Those are kind of like the three main things that I want to say I hear the most about. I want to first kind of distinguish between the first two. So, I want to talk about food allergies and food intolerances and kind of some of the differences in them. And then we'll kind of get into IBS as kind of the round out kind of finishing of this discussion. So food allergies and food intolerances are actually not the same thing. A lot of people think that they are, but they're different. Food allergies are immune mediated. So what that means is that your immune system is attacking some part of that food. It's usually a protein in the food, but it can be any component of the food, and basically it's creating an immune response to it. So it's basically kind of treating it like a foreign invader. Um, which is not great. Right, that can result in things like anaphylaxis kind of in severe forms, but it can also result in things like hives, itchiness, and also it can result in GI symptoms, right? So your body's just kind of trying to shed whatever it is that is ingested and doesn't like, similar to the way it would shed a stomach virus or something to that effect. um, so those are allergies. Those are a lot of times detectable with medical testing. So now we do have blood tests to determine food allergies. However, they are not all conclusive. So um, first, I want to be clear that these are blood tests that your doctor has to order. You have to go to a lab and they have to stick you with a needle. I am not referring to the home food sensitivity kits. Those are trash garbage. I actually did a whole other episode on that several weeks ago. I can link it down below. But basically, don't waste your money on those. That said, if you do suspect you have a food allergy, definitely, a first step can be getting your doctor to order what's called an E95 panel, which will basically test for IgE mediated food allergy. So IgE is an antibody that your body produces as part of its immune response. Now, I want to be clear that not all food allergies are IgE mediated. There can be non IgE mediated allergies as well, even though it is a true immune response. And there's really no way to tell the difference other than to run, and an E95 panel can be helpful. And if that is diagnostic, then great. If an E95 panel comes back clean and you're like, but I still suspect I have a food allergy, that's when it's time to go to an allergist and get a skin prick test. Those are, they basically run them. Sometimes they run them on your back. Usually it's a kind of up and down one of your arms, depending on how many things you want to test for. And that kind of just basically tests whether or not you have any kind of inflammatory response that may be mediated by an antibody other than IgE. So food allergies, they range in severity. I think it's also important to note that you can develop an allergy at any point in your life, and you can outgrow an allergy at any point in your life. Common trends are, a lot of times kids are diagnosed with a milk allergy, but they outgrow that kind of later in life. Same way adults can come into allergies that they never had before. So I think it's just kind of important to know that, because if you were told, when you were 5 that you're allergic to milk and you've never like questioned that ever since, you just avoided milk your whole life, you might want to get retested, because you may not have to avoid milk anymore, and that may open up a door for you in terms of different nutrition and things that you can now consume that you thought previously you couldn't. So I think it's just really important to kind of continually update that. I usually recommend about every 10 years, unless you kind of, suspect that you have a new allergy that's, not yet been diagnosed, then I think it's, obviously do it sooner. Food allergies, there's really nothing to do other than avoid your allergen. And depending on what that allergen is, that may be easy for you, it may be very difficult for you. And that's where definitely working with a registered dietitian, such as myself, we're experts in that. We're experts in showing you how to read food labels to determine if foods are safe for you to eat. We're also creative geniuses in terms of helping you to kind of navigate the food world without a while avoiding certain foods or one food or multiple foods, kind of depending on that. So definitely, work with a dietitian. A lot of times too, we'll also do tolerance tests too, kind of periodically to see if anything has changed. So definitely, partner with your healthcare practitioners if you do have a food allergy, because they can definitely make your health, your life feel a lot more livable, even in the presence of an allergy. Also, a quick note about celiac disease and wheat intolerance, and this will kind of give us a nice transition into intolerances. So celiac disease is a true gluten allergy. So gluten is found in wheat, but it is not limited to wheat. Gluten is also found in barley and rye, which are other grains. So it's really important to make sure that you are avoiding all sources of gluten, not just wheat. And there's a lot that goes into avoiding cross-contamination with gluten. So that's things like, someone has put a piece of toast in the family toaster and that toast contained wheat. Well, now you come in with your gluten-free bread. The bread is gluten-free until it touches the toaster. And that toaster, because it has touched wheat, now can pick up gluten particles from it. Most people who just have a sensitivity or an intolerance to gluten are not that sensitive, but if you do have true celiac, you are. So again, working with a dietitian, we can talk to you about all the sticking points of cross-contamination and kind of how to live with celiac, how to communicate that to friends, to family, to restaurants, and things like that. So definitely work with a dietitian if you hear or learn of any food allergies and you're kind of just lost and unsure what to do. And then there's food intolerances, right? And any food that you can be allergic to it, but you can also be intolerant to it. Intolerance means that there's no immune function. So that means that your body is not actively creating antibodies in an effort to destroy whatever that food is. So there's no immune response. Typically, that means that there's not things like hives or flushing or anaphylaxis and things like that, which honestly means they're a little less dangerous, but they definitely can cause problems over time. And they can also be very just uncomfortable to deal with. A lot of times food intolerances present as GI symptoms. So things like gas, bloating, extra flatulence, changes in bowel habits that can be either diarrhea or constipation, sometimes both. But very often we see that. So, and again, that's not necessarily dangerous in and of itself, but over time, you're creating this inflammation and this damage to the digestive tract, which is not good. Not to mention, it's just unpleasant, right? So, food intolerances can result from a lot of things. They can result from just not having the enzymes to break down certain types of foods. So, that can be things like lactose intolerance, for example. People who are lactose intolerant don't have the enzyme to break down lactose, which is the sugar that is in milk and milk products. So because they don't have that enzyme, they don't break the sugar down well. The sugar can't get absorbed and then it just kind of floats on into your colon. Basically, what should happen is it should get digested in the small intestine, get absorbed into the bloodstream there, and then it's never present in the colon. What happens is because it's not digested in the small intestine, it continues to float down into the large intestine, and then it meets your entire gut microbiome, who is just like ready to feast on it, and then that produces a lot of gas. It can also produce things like diarrhea, sometimes constipation. It really just abdominal pain, things like that. So those are intolerances, and things like that can happen with just about any type of food. So it can happen with, gluten, for example. It can happen with dairy products. And for a lot of people, what they find is that there is kind of like a threshold that, like, they can tolerate. So, for example, people with lactose intolerance, they may be able to tolerate a small amount of cheese on a taco or something, but they can't drink a glass of milk or they can't eat a big bowl of ice cream or things like that. So, there's usually some level of kind of threshold of how much they can eat or like how often they can eat it that they can kind of get away with, because usually your body can break it down to some extent. It just can't handle large quantities or frequent amounts, things like that, because it's just not producing those enzymes frequently enough. or in sufficient capacities to handle kind of a normal diet. So a lot of times that, again, working with a dietitian is a great way to kind of figure out, okay, where are your trigger points? Kind of what can you get away with and what do we really have to watch? And we can kind of help you figure that out in a structured way so you don't feel like you're just kind of bobbling and unsure. Um, and then that kind of leads us into the mother lode of all digestive issues, and that is IBS, or irritable bowel syndrome. So IBS is actually, to my knowledge, the only diagnosis that is not really a diagnosis. So typically when we think of medical diagnosis, we're like, okay, this is a problem and it's created by this mechanism. With IBS, we don't have that. With IBS, instead, we have, okay, we have a problem. It's characterized by these symptoms, and we have ruled out all of the mechanisms we've ever known to cause those symptoms. And it's none of those things, but we don't know what it is. So we're going to call it IBS. So that's basically just an umbrella term for kind of digestive upset, such as, gas, bloating, indigestion, diarrhea, constipation, etc. Even in kind of researching this, what we have found is that there are some commonalities. Very often, it is, definitely accompanied by either constipation or diarrhea or alternating bouts of both. And a lot of times there's like gas and bloating that kind of precedes that. Very often in my IBS patients, we don't even know, they've felt so awful for so long that they don't even know what normal feels like anymore. So if you're somebody who feels like you've like never had or like seldom have kind of regular bowel movements, this is probably you. What we have learned about IBS through some research is that what we think, kind of where we think the problem starts, is the microbiome. So if you're not familiar, your colon, which is at the very end of your digestive tract. So it goes, mouth, esophagus, stomach, small intestine, and large intestine is your colon. Your colon is lined with trillions of bacteria that are very important. And we don't know all of the ways in which they're important yet, to be perfectly honest with you. But it seems like every time we turn around, we find a new way that those bacteria are super important. And what we think happens is that basically people with IBS have a different makeup of bacteria in their colon. And that makeup is not necessarily good or bad. At least at this point, we don't have data to suggest that it is good or bad for their overall health. What we do know, though, or what we think happens anyways, that it makes them more prone to what is called fermentation. So basically, the bacteria that they host are more prone to kind of heavy gas production when they break down certain sugars and starches. It's not all sugars and starches, it's just certain ones. The foods in which those sugars and starches are found in really runs the gamut. It is everything from like onions to garlic to apples to celery to sweet potatoes to blackberries, and kind of a lot of things in between. And that said, things like, for example, shallots are okay, avocados are okay, blackberries are not, blueberries are, apples are not, oranges are. So, like, kind of things like that, like it's that nuanced. And what this boils down to is what are called FODMAPs, which are they're sugars and starches. The FODMAP is an acronym. It stands for fermentable oligosaccharides, disaccharides, monosaccharides, and pylrols, which is just basically a bunch of scientific words saying sugars and starches that turn to gas when your gut microbiota break them down. So we basically have these things that kind of are more prone to turning into gas, and then these bacteria that are more prone to creating gas. What that means is when they meet together, we wind up with basically a large gas bomb in your stomach. A lot of time that can present itself just as, gas, bloating, flatulence, abdominal distension. Like a lot of times people will like balloon out and almost look like they're pregnant. things like that. Sometimes that doesn't happen as much, but that gas does create, basically what happens is your colon's like, well, we've got to get this gas out of here. So it kind of creates this urgent diarrhea, right? Sometimes what happens is the, fecal matter that is in kind of the smaller part, the more anterior, kind of like earlier part of the colon, can't get past that gas bubble, and it creates more constipation. A lot of times what can happen is you can have alternating waves of both. So basically, you have this gas bubble that's kind of blown up your colon, kind of like one of those clown balloons that, like they're long at first, but like when you first blow it up, like it makes this big kind of like circle, and then it like shoots out long and kind of makes like a longer balloon that then they fold into like an animal or whatever. It's like that, right? But basically what that stretching does is it disrupts the normal peristalsis, or like muscle activity on the outside of your colon. So your colon's kind of like this long tube, and it's lined in a sheath of muscle that creates these kind of regular wave like motions to move the fecal mass just on down it. When those muscles are stretched, they can't contract properly. So we lose that big ability for nice, regular, smooth bowel movements. It can result in alternating waves, so constipation and diarrhea. So that happens very often too. Um, so the solution to this is kind of figuring out which of those FODMAPs you are triggered by. So basically, it is nuanced to the point that everybody's microbiome is very unique. Like as unique as a fingerprint is kind of a way of thinking about it, but it's actually like a fingerprint on steroids. Like it is 1,000 times more complicated than just a fingerprint. And then there's like everybody's diet is slightly nuanced. So kind of trying to figure it out is really, really tricky. We used to recommend that everybody who had IBS just avoid all FODMAPs. And that does work. It works to avoid, just follow a strict low FODMAP diet. That said, technically speaking, practically speaking, that's really hard to do. And compliance with those kinds of diets is low just because it's hard. It's really tough to live your life like that. And as a dietitian, my goal is to get as many different foods into your diet as possible. So I'm always an advocate that if we don't have to restrict it, let's not restrict it. Right? Let's find a way to incorporate it. So I spend a lot of time with my people working through low FODMAP protocols. And this is definitely something, like out of all of the things I've talked about today, this is definitely something you want a dietitian, not just a doctor, not just a healthcare provider, a dietitian, and a dietitian who knows what they're talking about and understands the ins and outs of a low FODMAP diet to help you with. Obviously, I can be that person for you. But if there's someone else in your area that, insurance covers or something like that, no hard feelings whatsoever. But definitely make sure you meet with a dietitian, and definitely make sure that dietitian is very familiar with a low FODMAP diet. And basically, we do a process of elimination in reverse. I usually have people eliminate all FODMAPs for really 2 to 4 weeks. It kind of just depends on how they respond. And then once they feel significantly better, we reintroduce each FODMAP category one at a time. And just because there's so much nuance there, that can definitely take a period of time. It takes at least 6 weeks, but it can definitely take longer to kind of tease apart things like, okay, you tolerate, I don't know, fructans is one of the groups. So things like onions and garlic, like you can have them, but only in small amounts. So you can have them, but you can only have them every other day, things like that. And then once you kind of, at the end of it, you actually have a very small list of restrictions, but it's so nuanced. It just takes us some time to get there, if that makes sense. So again, definitely something you want a dietitian to help you with, because it's complicated, and that's exactly why we're here. We're here to help with those things. So let us definitely seek us out. I hope that kind of helps to address. These are a lot of questions that I get from folks in terms of, just kind of general good, things that you can do to promote adequate GI health. Generally make sure you have enough fiber in your diet. The type of fiber can sometimes matter. So there's soluble fiber and there's insoluble fiber. Soluble fiber, both are found basically in fruits, vegetables, and grains. You can find more soluble fiber in things like fruits that have skins, but the non-skin part, that's usually the soluble fiber part. Insoluble fiber is kind of everywhere. And some people have kind of like a threshold for how much insoluble fiber they can handle. So a lot of times what I will recommend is if you find that you don't tolerate large amounts of like raw fruits or vegetables or things like that, you can supplement actually with like psyllium husk or console. If you are kind of diarrhea prone or loose stool prone, those things can just be helpful for you in general. Or if you just don't get enough fiber in your diet for whatever reason, those things can be really helpful to promote regular stools. They also are very helpful for things like diverticulosis or diverticulitis. Like I said, if you can't get enough fiber in your diet or you just don't tolerate large amounts of fiber from food, Metamucil and Console, anything that's a psyllium husk fiber, it can be really beneficial. Probiotics, the jury's still out on that, honestly. My usual recommendation, if you want to try probiotics, go for it. The research is really all over the map on it, unfortunately. There's not a lot of strong, I will say this, there's not a lot of strong evidence to support their use in IBS management. We kind of know that fairly conclusively now. What we have found basically is just that your gut microbiome is very resistant to change. And most probiotics have an order of billions of bacteria in the product. And they argue over whether it's like 3 billion or 5 billion or whatever. And to be honest with you, that doesn't matter because your colon has trillions of bacteria and they're not really open to newcomers, so to speak. So I think that's just kind of something to keep in mind. It definitely can be helpful for times when like you are experiencing more like mental stress, or if you're traveling and like your diet's just kind of out of whack, or like you're moving, house renovation, whatever, like kind of periods of time when your eating's just kind of off kilter. It can be very helpful for that. It can also be helpful if you've had a recent infection, like you had a really bad bug or you've had C. diff or something along those lines, something where like your basically intestinal lining has been shedding for several days, food poisoning, anything like that. It can be really helpful to help you rebuild that. But just for general overall maintenance, they're not particularly effective from what I have found. Other things, just kind of general management, watching caffeine intake, excuse me, kind of, moderating caffeine intake, and, is that caffeine is going to promote GI motility and sometimes GI stress. Also, mental stress and emotional stress is obviously going to affect your GI system as well. So making sure those things are managed well, whether that is with like, just kind of meditation, breathing exercises, setting healthy boundaries, therapy, kind of, whatever it is to get you emotionally well, your GI system will benefit from that as well. And there's actually some evidence that things like SSRI, so antidepressants, like Lexapro, Zoloft, things like that, they actually can help reduce GI side effects as well. Some of them are used actually off label to treat GI disorders. Kind of the nature of that gut brain connection isn't exactly teased out well yet, but we do know kind of, again, in those off label kind of anecdotal cases, it definitely helps. So again, if you think that either you would benefit from an antidepressant to help manage depression or anxiety, that may also benefit your GI system. And in some cases, it may just benefit your GI system, even if you don't feel as though you're struggling mentally, particularly. You have serotonin receptors in your GI system. So anything that affects serotonin is going to affect your GI system as well. That can also go south, right? That can also mean like, yeah, my depression's a lot better, but like I can't poop now. So it can go either way. Definitely being, in contact with your medical provider to kind of, and keep, and tell them everything, tell them kind of what you're experiencing. And then kind of finally, magnesium at night for constipation can be very helpful. Anywhere from 500 milligrams to 2 grams can be helpful to relieve constipation. And kind of playing with that dose, kind of depending on what you see, can be helpful as well. So I hope that answers many of your GI questions. Again, these are things that I get asked so often. But if there's something that we didn't talk about that pertains to your GI system and you just want to know more about it, by all means, let me know. Drop me a comment in the link in the drop me a comment below. Goodness gracious. And let me know kind of what it is that you're curious about and wanting to know, and who knows, maybe somebody else has the same question and that can be our next podcast. So I leave you all with that. I hope you have a great rest of your week, and I will see you next time.